Hello everyone, welcome back to our health discussion on chronic diseases. In today's discussion, I'll be talking on another chronic disease, hypertension. Hypertension is constant high blood pressure. How does high blood pressure set in? High blood pressure sets in when there is blockage in the blood vessels. Could be the arteries or the veins, causing the heart to exert excessive pressure in pumping blood to different parts of the body. There are so many things that we do, there are so many things that we eat that can predispose us to having hypertension, outside the genetic factor. Like I said in our previous discussion, that almost all the chronic disease can be inherited. Now, for the other factors that are not inherited, these are things that we can avoid. Like number one, saturated fats. Saturated fats are known to be number one cause of blockage of the blood vessels. This is because these fats are solid at room temperature. This therefore means that if you consume such fat in excess quantity, it takes a while before the body is able to remove the ones that is not needed. And most time, it becomes difficult for the body to do so because the body do not really have the capacity of removing these kinds of fats if they are in excess. Where can we obtain these saturated fats? Mostly from animal sources. Red meat is number one target, such as cow meat, pork meat, dog meat, just to mention a few. That is why we are advised that from the age of 25 upwards, we should reduce intake of red meat to avoid hypertension later in life. Aside red meat, there are other things that can predispose us to having hypertension. High consumption of eggs. Please, WHO has continuously advised us not to take too much eggs, depending on our body's ability to absorb fat. As you get older, please reduce consumption of eggs. Eat 1 or 2 eggs per day, depending on your body's ability to absorb fat, especially the elderly. Other factors that can predispose us to having hypertension is excessive intake of cold water, excessive intake of cold drinks, excessive intake of salt, excessive intake of sugar. These things are not good for us. Or excessive intake of alcohol. It tends to weaken the blood vessels, thereby predisposing us at the long run to having hypertension. Please take note that once we have hypertension for a long time, hypertension itself can predispose us to having stroke if it is not well managed. That is why it is always important for us to go for a routine health checkup in order to get to know the chronic diseases that we have, and we'll get to know them on time, because management and treatment is most effective at the earliest stage of chronic diseases. That is where treatment is most responsive. And at this point, I'm going to draw the curtain on chronic disease hypertension. In our next discussion, I'll discuss on other chronic disease. Please key in to these discussions. Thank you.